Yes.
Are we live?
Yes, we are live.
Perfect. So, hello everyone. Hopefully there are people there and listening to us. And welcome to our IFMSA Open Access webinar. We will be discussing about open access, and mainly the theme is from awareness to advocacy and from knowledge to practice. Today, first of all, I'm going to introduce the speakers that we're going to have with us today. So myself, I am Ada, IFMSA's Liaison Officer for Medical Education Issues for this term. We'll also be having Matthew, Nick, and Karin with us, and I will let them introduce themselves, starting with Matthew.
Hi everyone, my name is Matthew. I'm a fifth-year medical student from Brussels, Belgium, and I'm currently serving IFMSA as the Director on Research Exchange. And as you might know, we have been organizing our Open Access Week campaign on IFMSA social media, and today marks the highlight of that week with our webinar with our two guest speakers. So I'm really excited for it, and we will let them introduce themselves.
Perfect. So I'm Nick Shockey. I'm SPARC's Director of Programs and Engagement, and I'll talk about a little bit more about SPARC in a bit. But in that capacity, I also serve as the Director of the Right to Research Coalition and the lead organizer of OpenCon, which I'll also talk a bit about as well. But really excited to get the invitation to do this webcast and speak to IFMSA once again. It's always a great group. I'm so excited to join you for Open Access Week.
And hi, I'm Karin. I am a doctor from the UK. So I first, well, I'll explain, much like Nick, I'll explain a little bit about my open access journey. But just to explain that I graduated from medical school in 2012. I'm now specialising as an oncologist in the UK, although I've just started a PhD, so back to student days. But I'll explain a bit more about my journey through open access when we get there.
Great, so thank you all and welcome to this webinar, and definitely we're very, very happy and excited to have you, Nick and Karin, with us. We'll be discussing today a little bit about open access, what it is and why it's important, and then we'll move on to talk about open access advocacy and what you can do as medical students. We will also speak about IFMSA's work on open access and a little bit touch on the future directions of the open access movement. After the final key messages, we will have an open platform where you can ask your questions to all of us regarding open access practice. That being said, we're going to start by open access, and yes, Nick, the floor is yours.
Perfect. So to kick off the webcast, just want to provide a bit of an overview of open access, my organization SPARC, and some of the work that we do, how that intersects with IFMSA. Start to talk a little bit about why open access is important, though I'll leave a lot of that to Karin, since she has direct experience with how open access intersects with medicine. And then finally, I'll talk a little bit about the theme for this year and why we feel it's so important, particularly at this moment in time. So, you know, I think open access now has a lot more awareness than it did when I first started talking to IFMSA about it. And I think 2011 might have been the beginning, right around then anyway. But, you know, open access is the idea that all peer-reviewed research literature should be openly accessible online under an open license. So not just, you know, publicly accessible to read, but also ensuring that it comes with full reuse rights. So you can do things like text and data mine the literature, bulk download journal papers and take them to places that might not have good internet access. That you can really fully use the research literature, translate it into new languages. And the open access movement sort of grew out of what's been called the serials crisis, or essentially the sort of crisis of ever-escalating prices of scholarly journals. And so, I imagine many of you have probably heard the term open access at this point, but one of the things that folks are often unaware of is just how spectacularly expensive academic journals can be. There's a publication based in the US called Library Journal that every year does what they call a periodical pricing survey, essentially just a survey of journal prices. And for a number of years now, I think at least half a decade, there have been more than 15 entire academic disciplines, including medicine, where the average price for a journal subscription is more than $1,000 per journal per year. Again, on average, and the individual journals can be much, much more expensive than that, even, 5, 10, 15, even upwards of $20,000 per year, in some cases for the very most expensive journals. And so, I imagine that that many of you, or probably all of you, honestly, have had the experience of finding an article that would be helpful either for your education or for a situation that a patient that you might be treating is facing, and hitting a paywall, not being able to get access to it. And so the reason why is just the incredible cost of getting access to these journals. So that's sort of a little overview of open access and sort of what the movement has grown out of. My organization, SPARC, is a library membership organization that focuses on advocating for open access to research articles, research data, and educational materials as well. And over the 10 years that I've been at SPARC, one of my sort of main focuses, and the reason I started at SPARC originally, was to build SPARC's student advocacy program, and really work with next generation leaders to become sort of leading voices of the open access movement. And so it's been a pleasure to work with IFMSA closely for close to a decade now, in advancing that work. And the program that's most relevant to IFMSA at this point, that we run, is a sort of global community called OpenCon that seeks to identify and sort of elevate the next generation leaders from all around the world, sort of lead the push for open access, open data, and open education as well. And we typically have a sort of main global meeting every year that I believe IFMSA has been involved in organizing in one way or another. I think just about all of those since the first one we had in 2014. But there are also satellite events that are hosted around the world locally, that I'll share a little bit more about towards the end, in different ways that you can get involved. But I mentioned that just to sort of highlight that the next generation leaders and students have increasingly been at the forefront of the push to make open the default for research and education. And that's only becoming increasingly the case now. And after Karin shares a little bit, I'll share a little bit about some IFMSA affiliated folks that have sort of gone on to be really impactful in doing education and advocacy work around open access. After sort of getting involved in this issue through IFMSA. So next slide, please. It is, of course, International Open Access Week, sort of the International Week of Awareness for open access as an issue. And we are particularly excited about this year's theme of open for whom equity and open knowledge. And the idea behind this theme, and sort of why our advisory committee for International Open Access Week settled on it, is really to try to center the conversation around not just reaching sort of a system for disseminating research results that's open by default, but one that really prioritizes equity, and sort of pursues openness in relation to equity. And making sure that as we are, sort of creating and adopting open policies and open practices, that is done in a way that intentionally sort of builds equity into the foundation, and recognizes that while there are really powerful ways that open can advance equity, that if we're not intentional about it, open can also allow inequities to remain in the system or even strengthen some of the inequities. And so we have to be really intentional, about prioritizing equity and inclusion in this work. And so, there are lots of ways that directly relates to open access, doing things like paying attention to the business models that we use for disseminating the results of research to make sure that folks, can not only read the research literature, but also have the ability to fully participate in the conversation and publish and share their works without having to pay significant sums that would interfere with that is one example. Or we pay attention to the languages that are used in the ways that languages besides English are often marginalized in the global scholarly discussion, and finding ways to address that. So there are really important ways that sort of direct intersections between equity and open, but there's also sort of a more fundamental way in which sort of the shift to open access is connected with reaching a more equitable system, and that is sort of as as sort of research makes this big shift from being sort of closed to being more open. I think it allows us to have more fundamental conversations about just sort of equity and inclusion in research much more generally, and examine some of the foundations of sort of our system for research, and see how closely those align with the values that we talk about in terms of equity and inclusion. And there are lots of different aspects there, but one that I wanted to raise, because I think it's particularly relevant to this group, especially given that IFMSA is such an international and global organization. If you go to the next slide. I purposefully didn't title this slide because I wanted folks to just take a look at the cities that are listed here and see if you can recognize any patterns. I think it's pretty easy to see where most of these are based once you read through them. So as you've no doubt noticed now, these are essentially exclusively in North America and Europe, with one notable exception of Durban in South Africa. And so with that in mind, you can go to the next slide. This is actually the list of the cities that the current editorial board members of the most widely read, cited, and influential general medical periodical in the world are based. And so one of the issues that we definitely wanted to make sure to flag during Open Access Week around this theme of open for whom equity and open knowledge is, for example, the extent to which the editorial boards on journals are often not representative of the population that they seek to serve. And I think if you were to look at the editorial boards of many journals, they don't look nearly as as diverse or global in scope as IFMSA is, for example. And I think when the editorial boards of sort of leading journals are based in such a narrow range of places, it inevitably affects the questions that get prioritized in the research. That has an effect on what research questions get asked, and what types of research are prioritized, between research that's most impactful, in places like the cities that are listed on the slide, or the research that would be most impactful globally, and seek to address, diseases or other health conditions that are of more pressing concern, in Africa, in Asia, and Latin America, but are less of a concern, for the locations where, the editorial board members are based. So, I think this is just one example of, sort of to us what it means to try to pursue equity and open knowledge, and sort of ask these critical questions about, representation, for example. So with that, I will turn it over to Karin to talk a little bit about her experience and why open access is important from her perspective.
So I'll maybe talk a bit about what I have done specifically in the area of open access a bit later on, but I'll maybe just to continue that theme of why it's particularly relevant to us, which is why you very kindly invited me to talk on this panel. This is me, obviously, in this picture, and this is my other day life, I suppose, as a doctor. This is when I was a slightly more junior doctor. But if you move on to the next slide, we are often cited as a group as the reason why this is such an important issue, in some ways over all other areas, which is its own, obviously, would be its own topic for debate. But obviously, research is fundamental to evidence-based medicine. we do the things that we do in hospital because someone has at some point done a study to prove that that is the right thing to do, and that's the only way that we continue to do the right things by our patients, is to read the latest evidence, the latest studies. Certainly in my field of oncology, clinical trials are basically central to how we do our practice. So that's central to being a good practicing clinician. But obviously you can only use that if it's actually available to you, and access in this case is knowledge. But I think another aspect of it which I thought was interesting when I first became interested in open access was that this is really the right of the general public who fund our research. So I'm obviously now taking time out to do research, and as I'll explain later on, I've taken quite a few bits of time out to do research, and it's almost always funded by the taxpayer. And in the UK, because like many parts of the world, we have a publicly funded healthcare system, as a doctor, I'm also essentially a public servant. So it's the right of the general public to be able to read the research that they fund. And going on to the rights of the patients, these are patients that participate in these studies. And now as someone who's involved with clinical trial work on a clinical level, I mean, these people are absolute heroes as far as I'm concerned. You know, they give up their time, which is a lot of time, to be participating in research. And it's only right that we make sure that the research that results from that is available for them, not only to read, but potentially benefit from. Should we move on to the next slide? And I suppose from this point of view, it can always feel a bit daunting, as in, why are you the most important as a medical student? But I would say that you absolutely are, now that I'm a bit further along the line of things. The IFMSA is such a strong community, and even just on this call, those of us that are speaking are hitting, you know, different areas of the world, 3 continents, I think, just on the speaker panel. And that's an amazing community that you have. In addition to that, the IFMSA allows connections to many other communities, not least the one that Nick is here representing today. There's a degree of shared resources, which I know that Ala's made some slides on later on, which are such an unbelievable resource, and OpenCon really represents that as well. We're able to share information, share resources, so that no one's having to duplicate work. And something I probably will hammer on about a bit later on is also time. I know that you probably think as a student you're busy, but oh my goodness, as a doctor, are you busy? And now is the time to make the most of the opportunities and freedom that you have. As I say, I know it doesn't feel like you've got freedom, but for example, this evening I've just spent a day in the lab, I'm doing this call, and then I'm going on call later on. That's a busy lifestyle that you have to adapt to when you become a doctor. And as a student, make the most of the time that you have to instill these practices in your daily practice. I'll maybe stop there and leave Ala to maybe talk on the next slide, and then we'll come back to what specific things you can do with that in mind.
Yes, thank you so much, Karin and Nick. And I really must agree, IFMSA, representing medical students, has done a lot of work on open access. And one of the important things was back in 2017, when we adopted the IFMSA policy document on open access, open education, and open data, mainly calling for increased availability of published research free of restrictions for everyone online. And this policy document comes in very handy because as medical students, we are at the center of the institutions that we learn in, and we are at a position where we can use our efforts to advocate for more open access. And this policy document can be very helpful for you as medical students whenever you feel that you want to take local action. But more on that, of course, at the end of the webinar. The second part that we work on as well is access to research and research education. And I think Matthew, our Research Exchange Director, will talk to you more about this, as it is one of our global priorities, has been for the past 2 years, actually.
Yes, thank you, Ala. Exactly. As Ala said, access to research and research education has been a global priority of IFMSA for the past 2 years. So we're continuing this year to work on this priority for our federation. And a global priority for IFMSA means that its members vote on the goals and vote on what exactly we will work on to increase the access to research and research education. This was joined then this year, earlier this year during the IFMSA March meeting, where members voted on a policy document on access to research and research education, which lays the groundwork for our internal and external work that we are doing right now. And IFMSA in the previous years has been focusing more and more on research education instead of only providing students exchanges. And here are a few examples of how IFMSA has been trying to improve access to research and research education. So first of all, of course, through our worldwide research exchange program, which includes more than 1,500 research projects available to students from more than 80 countries. So on a yearly basis, we have about 3,000 students who have the opportunity to go on a research exchange and to have access to research, which is something they do not always have in their home universities. Then 2 years ago, we also started with a new initiative, which is called Research Camp, which is a 5-day event that IFMSA organizes on an annual basis. And to sum it up, it is peer education and peer research education. So it's about students actually teaching other students on how to develop their own research. And in that research camp, we usually have about 20 to 25 participants who by the end of it can develop their own research and go back to their home universities to start up their research projects. So 2 years ago, we had a first edition in Hungary. And in July of 2019, we had the second edition in Jordan. And we are, of course, going to continue this tradition next summer by having 1 or 2 research camps in order to increase the access to research education for students all over the world. Now, IFMSA also has a lot of regional or global events. And at these events, we always try to include sessions about research education, about advocacy, and about open access. This is part of our goals in our global priority that we're trying to achieve. And this will only increase in the future, where we are always going to provide at least 1 session about open access, about open science, and about research-specific workshops at every IFMSA events. This includes our regional meetings as well as our general assemblies. And in the previous years, IFMSA has also been trying to create activities that are very research-oriented for its members, its national member organizations to implement towards its local and national members. So we are currently developing 3 educational activities. 1 is about open science, 1 is about critical appraisal, and the last one is about basic concepts of medical research. And with these activities, we're creating a toolkit that is composed of a training manual and of an evaluation form in order to assess the impact of the training. So our goal with these trainings are that they can be implemented on both the local, national, and even at international events in order for students to teach other students about these important topics. Now, talking about campaigns, other than the Open Access Week that we organize every year, we also have our Exchanges Week, joined with our Standing Committee on Professional Exchanges, where we do have a whole week of social media campaigns in order to promote the exchanges that IFMSA organizes. And 1 day is usually regarding research education and Open Access Week. Furthermore, 2 years ago, we started up with another initiative, namely our Research Awareness Campaign, which is an online campaign where all of our members collaborated, and we tried to increase the awareness about the importance of research for medical students. We're going to try to organize a campaign annually with the help of all of our members, and we're also trying to set up regional campaigns as the awareness and research is very different in every region and even in every country. And last year, or last summer, to be more precisely, we also had our abstract accepted and presented at the Association for Medical Education in Europe conference, which highlighted the survey we did in the previous year on access to research and research education. which was filled in by more than 600 participants from the 5 regions from all continents. So we had a very big representation of students filling in this survey for us to assess what the access to research and research education was worldwide. End to end, we also had a new initiative last year, which is the creation of a resources database, which is a database that we share with our members and includes both massive open online courses as well as videos and open access books that students can always access in order to educate themselves about research. So I will let Karin and Nick continue with their stories.
So I thought it would be helpful just to explain a little bit about my journey through open access, to hopefully give some ideas as to how you might get involved if it's something that you would like to or can sort of get involved with. So obviously, as I say, I met Nick, which is us, in 2011, looking fresh-faced, when we met at IFMSA Copenhagen. So at that point, I had just finished my science degree, was about to go for my final year of my medical degree, and yeah, that meeting with Nick was really sort of what got me involved with open access, and as a result of that, wrote an article for Student BMJ, which is still available, which tried to bring together the sort of general issues and why medical students were, you know, a particularly relevant group. And then went and I was, at the time, I was the chair of the British Medical Association's Medical Students Committee. So I thought it was important that the BMA should have a policy on open access. So I wrote one and got it passed through our student conference, and then passed this policy at the National BMA conference that summer. So and it was really the first time I'd had any experience of, I mean, it's not like I had experience in writing policies, or indeed a lot of experience at the time of writing articles, but I had lots of resources and help available to me to help me to do that. I then qualified as a junior doctor and went down to work in Oxford for a couple of years. And as you can see, there's a bit of a blank patch there. I'll come back to that. And then during my sort of early, between my intern and residency years, I was lucky enough to get a Fulbright scholarship to go and finish my master's in the States. And that was when OpenCon began, which Nick has touched on, which is this amazing conference which runs every year and has a community that builds between times. And through that, again, to cut a long story short, we decided to try and work on a Fulbright policy on open access, which was the funding body, which again is generally publicly funded for the most part. And also from following on from OpenCon, which was an amazing opportunity to meet fellow advocates from a whole range of areas, including doctors, but also from a whole range of subjects. And we developed the OpenCon community call, which allowed us to kind of keep contact between times, as I'm sure IFMSA finds it's very difficult to bring people together and to maintain the communities that you develop at once a year conferences. And the OpenCon community call was designed as a way of us staying in touch. And it was really a great experience to learn about the challenges of that, as much as how to keep these things going and the resources that you need. And we were really lucky to have so much support. Well, you know, it's basically OpenCon machinery, Joe MacArthur, Nick and his team that have kept that going. I then went back into clinical training and have we've run an OpenCon community call for medical students and doctors a couple of years ago, but again, OpenCon has been going on every year, which is great. And I was invited to speak about my experience of writing some policies when it was in Brussels and also at the SPARC conference in San Antonio. But again, I know I've come back to this, but you'll see there's a theme here. The times when I've been able to really do active work in terms of proactive policy advocacy work has been when I've been in some way doing non-clinical work, basically, because being a clinician is incredibly busy, and you'll know from your time at medical school that you've always got exams and things going, and that doesn't finish when you qualify. So I would say the take-home message from this is that when you're a student, it's an opportunity to develop the habits of a lifetime, basically. And for me, developing an interest in open access has allowed me to pursue that as my status quo. Even when I can't do advocacy work, I can embody that even when I'm in my day-to-day working life. And I'll give some examples of that perhaps in the next slide. if we move on, yeah, great. So this was a particular example of the advocacy work that I got involved with when I first met Nick and the work that followed. So the British Medical Association is the representative group for doctors and medical students in the UK, and policy, which I didn't have a clue how to write, I was helped out there by the fact that the Right to Research Coalition had a statement on open access, and which we passed through the Medical Student Conference. So I guess that's learning point A, is that find out what your local organisations are, or national organisations are, and work your way through them, because they're usually easy to get a bit of airtime in those settings, and that allows you to do as I did and then get it selected for a national conference, and the adult, as it were, conference in that case, and then it got passed and became policy. And that was important because the BMA is closely allied with the BMJ, which obviously is an enormous journal in the UK for well, everyone really, but for doctors and in a wide range of fields. But why was that even important to even do that? Why is it important to have a policy? Well, suddenly I went from being an issue that I thought was quite important to being highlighted to doctors all over the UK. You know, the BMA's national conference is all the press from the UK come to that conference. So it highlighted that doctors thought this was an important issue. It gave me confidence to think that actually, because I had no background in policy writing or anything to do with open access, but it gave me the confidence that even if I didn't know all the answers or all the information about open access, that I had a community around me that would help me with those questions, and that if I pursue this as a policy, then we could get things moving forward. And as I say, that confidence, I guess, led to writing the policy for the US-UK Fulbright Commission. So just basically these opportunities help you gain some confidence moving forward. Can we move on to the next slide? So I guess moving on to like what you can do, I guess much as IFMSA, well, this was how we approached things back in the day, without wishing to sound too old. And I think it's a really good way of looking at it, is what can you do locally versus acting globally. Sorry, 1 second, I'll just move because I can hear there's some noise behind me. 1 second. Hi there, hopefully you can still hear me. Apologies about that. Obviously you can act locally by developing. One thing I did was I developed a personal repository. So I contacted my university at the time and asked if I could set up a repository, and the librarians couldn't have been more helpful in setting that up for me. And that's still available, actually. I need to update it, but that's a very easy thing that you can do, is contact your local library. Also, you can just ask the questions. So now I'm a PhD student now, but I've published some work of my own. And I know this is going to be, as someone who wants to be a clinician scientist and do research, it's going to be an important thing for me moving forward, as I'm sure it is for many of you. And simply asking the question, if you're a co-author on a paper or a co-author on a case study, which is usually, I think, the first way that medical students get publications often, just ask the question. You know, I recently was involved in a case report where the chief author said, oh, what about these papers? And I said, well, can we put it to the one that's open access? And it was accepted. And that's where we published it, which is great. But I don't think they really minded either way. But the fact that I even said that raised the issue, made that see that this is an important thing. Further, you can ask the question at your library, at your universities. Ask your universities if they've got a policy, and that leads on to the global. Lobby your university to have an open access policy. Again, they may have not thought about it, but at the same time, many universities do now have open access policies, and it's a good way to get people understanding the issue. And so, again, my second take-home message would be just to ask the question, and you'd be surprised by the response that you would get. So I guess this is also mine, but basically I would say the final key message overall is that we are, as I'm sure Nick will agree, the medical students are often cited as the reason for one of the key reasons why open access is so important. And as a student, you have more power than you know that you have. So we are a central reason. So it's really important that our voice is heard.
So building on that awesome overview from Karin on
yes,
sort of,
definitely.
Go ahead.
Thank you, Karin. I'm going to give you the floor.
Yeah, I was just going to share, some more general thoughts, building off of those that Karin mentioned. I mean, I think there are, a number of potential ways for um, med students, involved in IFMSA to get involved in open access advocacy. Sort of first and foremost, as you've already referenced, is just through IFMSA itself and the policy statement, and using that to advocate for open access locally in the ways that Karin also mentioned. There are an increasing number of universities around the world that have what are called institutional open access policies that require that any articles published by faculty need to be made publicly accessible through an institutional repository. It's a great way to make sure that your university's research output is openly accessible, and many of the sort of leading institutions in research institutions in the world have those policies, and so you can point to those as sort of important precedent, for your institution to consider following. As Karin also mentioned, there's a broader advocacy component as well, both within the medical organizations that you sort of operate within your individual countries, but also even at the national and international level. There are, medical students have been involved in advocacy pushes at the national level for policies such as those here in the United States, where the U.S. National Institutes of Health, all of the research that it publishes is required to be publicly accessible within 12 months. And in 2013, that policy was extended to the rest of the U.S. federal government. One of the interesting sort of pieces of advocacy that helped make that happen was an op-ed in one of the highest profile newspapers here in the U.S. That was co-published by Liz Wiley, the president of the American Medical Student Association at the time, and the president of the National Association of Graduate Professional Students here, that helped put pressure on the White House at the time to take action. And so, as open access continues to gain momentum, there are almost certainly opportunities for that advocacy in your country locally, or even potentially at the international level. So one of the final things I wanted to be sure to mention, especially because of the theme for Open Access Week this year, that might also be a way, sort of potential next steps for IFMSA as an organization and working on these issues, is to think about ways to not only advance open access, but sort of knowledge equity more generally. So looking at ways to update the statement on open access to not only call for openness, but also trying to make research itself more equitable and inclusive. So doing things like calling for better global representation on editorial boards of journals, for example, or in leading international medical organizations, and really asking folks to pay attention to whose voices are included and prioritized, at those meetings, on stage, on the committees that lead those organizations, and be a voice to make that much more globally inclusive. And I think IFMSA is in a particularly strong position, in that these organizations honestly need to look a lot more like IFMSA than they do currently. You have the networks of individuals that can really help to make those institutions more globally inclusive. And so I think it would be a great way to continue to build on the great work that IFMSA is already doing around open, to extend that even more to conversations around equity. And the final thing I'll say there is that it's been interesting to watch sort of how the open access movement's progressed over the past 10 years, and even the past couple of years. I think we've really transitioned from the main question being sort of whether open is a good thing, to really being sort of how we're going to get to open, and sort of going from aspiration to implementation. And as that happens, I think it's especially important now that we ask these questions around equity and inclusion, because we are sort of in the middle of starting to build sort of the open systems, the open policies that we're going to sort of live with for many decades into the future. And it's important to really pay attention to how inclusive those are, and sort of as we're laying the foundations for them. and really trying to keep that in mind. And so that's why the theme for Open Access Week this year is Open for Whom? Equity and Open Knowledge. And I think it's just particularly relevant for IFMSA given its global nature and how sort of advanced it is, and really thinking about how to be globally inclusive compared to most other organizations.
Perfect. Thank you so much, Nick. And I think that's just a very perfect way to end. IFMSA always stands for equity, and that's one of the reasons why open access is a very important topic for us. Advocacy that they can do in their schools and universities. Publishing open access is also an individual decision, and if we can get ourselves as community, having the knowledge that yes, open access is good, to actually practicing open access. Perfect. So I hope you can hear me well. Okay, that being said, Matthew, do you want to share any final key messages?
Yes, I will just share from my side a few key messages. I think most of it has been said. I will say it more from the perspective of IFMSA members. I think for medical students and for healthcare students, it's often not understood why open access is important for them and how they can benefit from it and what they can do to also advocate for open access. And I think that is what this campaign was about, especially the theme of this year. And as a key message, especially what Karin said regarding ask for a repository, ask for an open access policy in your university. From my experience, I know that my local university also hosts an open access campaign on a local level to highlight all the tools that my university provides for students and all the access we have for journals. And although we are organizing a campaign on an international level through social media, I think I've heard from a lot of from national member organizations in IFMSA that they are also organizing their own campaigns in order to advocate for open access. I know Indonesia, to give an example, is organizing a research awareness campaign with the team of open access next month. And I would encourage all, both national member organizations, but also all local committees to advocate for open access, to raise awareness for it amongst all medical and healthcare students. That's it from my side.
Yes. I also want to encourage medical students to transition from just knowing about open access to actually practicing it on an individual level. When we transition to clinicians and possibly researchers, we should always remember that equity is at the core of our values, and this is why we stand with open access at IFMSA. We are now at the final part of our webinar, which is a Q&A. We had a couple of questions posted through Instagram, and I think Nick and Karin, I will just read them out for you, and we can of course hear the answers. The first question says, journals with paywalls benefit from it to cover for reviewing and publishing costs. Open access is good, but won't this translate as a higher publication fee for authors, or maybe affect the quality of journals? So yes, what do you think?
Yeah, happy to address that. I think to me, that question raised an important or an important question, which is, that we have to be realistic about, the costs that are involved in publishing. And, I think, open access advocates are, this isn't sort of like a utopian vision, that these things come without cost. I think most advocates do have, a sense that, that there are real costs involved, and it's just a question of covering them in different ways. And so, I think, to me, and I think for a lot of folks that have done the analysis, it's pretty clear that there's more than enough money in the system. We spend, literally more than $10 billion a year on academic publications. So there, the money is in the system. It's just that, right now it is allocated in such a way that it's through subscriptions rather than covering those costs up front, so that the results of research can be made openly accessible. And so to me, it's not about, trying to do this work, totally without, incurring costs. It's just about shifting the funding streams, from the current subscription model, to other ones that cover the costs up front. And there are a variety of business models for open access publications. And in fact, a majority of them listed on the directory of open access journals, which is sort of like an index for OA journals. A majority of them actually don't charge anything to authors or to readers, so are free both to publish in as well as to read. But there is a very significant number of journals that do charge what are called article processing charges, that you charge authors or their institutions or the funding bodies that support that research to cover the costs of publications. And these APCs have sort of long been sort of identified as a transition mechanism to open access. And the idea there is not to make individual researchers pay, but to try to shift that cost to institutions to pay up front, or for increasing number of funders are covering those fees for authors. And many journals that charge APCs will waive them for authors that request them, though not always. And sometimes the process for that isn't very transparent. Sometimes it's not successful for authors. But I think we have to be really conscious of the ways that business models like the APC model can replicate inequities and sort of flip the inequity from not being able to read publications to introducing a barrier to being able to participate in the scholarly publication, the scholarly conversation rather. And so there are experiments, new ones that are coming online every year, that test different business models that avoid those kinds of charges, but still cover the necessary costs of publication. So examples would be things like the Open Library of the Humanities, for example, that has a membership model where institutions join, that covers the sort of the cost of the publications that they put out there, so that they don't have to charge anything to authors or readers, or other journals are housed within institutions, and don't have nearly as many costs as some of the higher profile publications, and can sort of operate within an institution at low enough cost that they don't need to charge anything to authors, or to readers. So there are a variety of models with for new experiments coming on online all the time. And I think that, again, to emphasize the main thing, I think it's just making sure that the way we structure these open publications align with our values around equity and inclusion. There's also the question of sort of quality that was raised, I think, in the second half of that. And I think there's a range of quality in open access journals, just in the same way that there's a range of quality with traditional subscription-based publications. So there's often concern raised around the quality of some open access journals, and we should definitely be sort of vigilant about the quality of all publications. So I think it's a legitimate concern and one we have to seriously address, but I think it's also one that's not just limited to open access journals. There are similar issues in subscription-based publications. as well. And the other piece of this is that I think the community also just needs to move away from journal-based metrics entirely anyway, and stop paying attention to things like the journal impact factor, which is frankly a statistically illiterate way to judge the impact of an individual article, right? Because it looks at the rate of citation for the container that it's published in, which doesn't tell you anything about the specific article itself. So I think we should be looking for ways to really judge the merit and the impact of individual contributions rather than the container that something is published in as well. And if you haven't heard of DORA, the San Francisco Declaration on Research Assessment, that's a really good both statement to read as well as a resource for learning more about alternative ways to evaluate research outputs. Sorry, that was a long
Thank
answer.
you so much. But it was very informative, and I think much of our viewers will appreciate it because it answers a true concern. The second question is from a student from Asia Pacific, and he asks, what are the opportunities for us as students to get more engaged with open access? Are there regional representatives, for example?
Yeah, great question. I'd love to know which country they're from or is joining from Asia, and I could maybe be even a little bit more specific. But there are a variety of even entire organizations that have been started by members of the OpenCon community, some of which were actually sort of came into this through IFMSA. So, for example, Rashan Karin, who was participated in IFMSA through the Nepalese Medical Student Society, founded an organization. It's probably been at least 5 years now, called Open Access Nepal, that set up chapters at the universities throughout the country there to raise awareness about open access, to advance sort of the adoption of open policies and practices at universities in Nepal, and even advocate at the national level for policy change. Again, somebody that came to this through a similar presentation to this one at IFMSA. There are also is an organization called Open Access Bangladesh. There's Open Access India, and there's actually been a series of OpenCon satellite events in Indonesia, I believe primarily in Jakarta, led by a former undergraduate student there who's since actually moved to New York here in the U.S. To go to grad school. But there's been quite a bit of sort of like a critical mass of activity there as well. And so, if you could tell me which countries you're from, I'm happy to connect you with the advocates that we know there. The other thing I'll say is that if you're interested in trying to catalyze more of a local open community, you might consider hosting a local OpenCon satellite event, which many folks have found is useful in sort of bringing together open advocates, that they might not have known, but when they see the announcement for these events, end up registering and participating, and can be helpful in building a network of advocates to do this work locally. And there have definitely been plenty of those in both the Asia Pacific region and every continent around the world. And so there are local organizers that can give you sort of tips and advice on how to do that, and be happy to connect you with those folks directly if you want to follow up with me afterwards.
Perfect. Unfortunately, I cannot really ask that question, which country, because we got it from Instagram yesterday, but I hope he has heard your answer, and we will definitely try to promote as well. The final question, hypothetical question, because it says, is open access, what do you think?
Is open access achievable?
Yes, as simple as that.
Mm-hmm. Yeah, I think it is. And while I think we still have our work cut out for us to really build strong open policies and practices into the heart of the research community, there's definitely continuing momentum there. And so I don't want to take away from the need for advocacy still, because it's definitely still there. But there's clearly a lot of momentum, and it's sort of building, honestly, by the month. And some examples of that are just how seriously, the policy discussions are advancing all around the world, in places like the European Commission and the European Parliament, looking at, continuing to strengthen not only their policies, but also to make significant investments in a European open science cloud to provide infrastructure to do this work. There are ongoing policy discussions about strengthening, the open science policies in the US, and we helped to pass the Open Government Data Act through the US Congress at the very beginning of this year that sort of sets the default to open for all government data, which also includes a significant amount of research data as well, to other countries around the world, in Latin America and Africa and Asia, where there are national level conversations about either implementing for the first time or strengthening policies around open science. And so, I think open access is very much achievable in that light, and there's a lot of momentum. But I think, as I flagged at numerous parts, of this conversation, I think to me the main question now is almost less about sort of whether open access will happen or not, and more about sort of what it will look like and who will be included in that vision. And so, to me, I think the questions we need to be asking are like the prompts for Open Access Week, right? Of really asking, we're achieving open access, but, open for whom, right? Who is included in this? Are the structures that we're building, globally inclusive in the ways, that they should be, if we're going to get to, make a fundamentally more equitable system for, medical research specifically, but just, research and education more broadly as well. And, as I flagged, I think it's a role that IFMSA is particularly well suited to play. Two final things, that I'll mention if you want to get more involved in this work. Somebody, I can't remember who, already mentioned librarians. I think it was Karin. Yeah, it was in the context of the repositories. But I would strongly encourage you to reach out to your local librarians at your institution that are typically, will be very well versed in open access or open science, or at least have somebody on staff that's familiar with those issues. And I'm sure would be overjoyed to hear interest coming up from, from students or from the faculty on campus. And then the other thing is just to consider connecting with some of the IFMSA alumni that have been so powerful in this movement. So I've already mentioned Rashan Karin, who started Open Access Nepal. There are many others that have founded similar organizations that came out of IFMSA, like Ahmed Ogunlaja, who started Open Access Nigeria, Osman Al-Dadiri, who started Open Sudan, and a handful of others like that. Also, the assistant director for the Right to Research Coalition, Joe MacArthur, actually came, or rather, I actually met him for the first time at an IFMSA meeting in 2013 in Baltimore, and he's now sort of one of a leading figure in the open movement that's helped to build OpenCon from the ground up, and is building really important tools for the open research community in his Open Access Button project. So there's so many folks that have come to these issues through IFMSA and have gone on to have impacts in a variety of different ways that we'd be happy to connect you with. So let me stop there before I bring us to the end of the call. I'm sure, Karin, you have some responses to that as well.
I guess just to add very briefly, it is happening. Like, open access is happening, in the sense that this is a wave, and it should be one that we all get on. Like, now I'm funded by a funding body which mandates that my output is open access. It's something which most supervisors in the UK, most institutions and funding bodies are mandating open access. And as Nick says, I think the discussion is more about how does that manifest. It's fine to say, your publication should be open access, but how do we make the most of justifying and explaining why that's so much better, how much more visible your work is, why does it have to be in a paper? And I think now I see much more on Twitter that you see big PIs, big supervisors in their fields saying, this big paper has criticized me for putting my preprint on bioRxiv. This is wrong, and the community rallying around that. And that's a really new, I would say, really new voice that we're hearing. So I don't think it's a question of if or how, it's just a matter of it's not a matter of if, it's a matter of how, and that we are part of the voice that shape that discussion about how we make it the best it can be.
Perfect. I think that's a very powerful message to end today's webinar. And before we do, I just want to thank you again, Nick and Karin, for joining us. And I really hope that all our viewers have made the best out of this and possibly continue to be open access advocates in their contexts. Thank you so much, everyone. And this marks the end of our webinar.
Bye, everyone.
Bye, everyone. Thank you so much for joining.
Bye-bye.